Welcome to Picture of Health. I'm your host, Lauren Lengyel. With me in studio today, we have Juli Davis, who is with Tobacco Free Polk, and we have Bethany Coz, who is with Tobacco Free Florida. And we're very fortunate to have you both here because you bring a wealth of knowledge on the subject of tobacco, nicotine, and other not so good things for us. So welcome.
Thank you.
So, Juli, tell me a little bit about what you do.
I'm with the Florida Department of Health in Polk County, and I work with work sites to help them strengthen their tobacco policies and also to encourage them to offer cessation services through their health insurance to their employers who want to quit. I also work with multi-unit housing complexes, encouraging them to go smoke-free as secondhand smoke travels through everything, and we have a very high rate in Polk County of hospitalizations due to asthma. So we're trying to reduce that exposure to the residents. There is also what's called point of sale, and that is looking at how the tobacco industry targets youth with the placement of their products in stores. So when you go to purchase something, it's oftentimes right there. We also are working with college campuses to help them to strengthen their tobacco policies. And we've heard a lot of our businesses, the multi-unit housing, and the colleges to Central Florida area health education centers for their cessation programs.
And when you say policies, you mean we're changing our policy, meaning this is going to be a no smoking campus. And what are some other, is that?
It could be smoke free. It could be completely tobacco free. It could be we are going to designate smoking areas that are 25 to 50 feet away from any building. So it could just be strengthening that. We also are finding that a lot of policies are lacking the electronic cigarettes, or ENDS, which are electronic nicotine delivery systems. So that includes your e-cigarettes or vaping, the e-hookah, e-pipes. There's all sorts of electronic devices out there. So a lot of businesses, a lot of colleges, and a lot of multi-unit housing complexes are being caught off guard by that.
Right. So when that happens, that's where you come in, and tell us a little bit about what you do.
So we are the resource where people are thinking about or ready to quit tobacco, and we provide in-person coaching, and we help people create a quit plan. And we know through the research that with some type of support, whether it be in person or phone or web, as well as the free nicotine products we give out, it's going to double their chances of success. So we're there to kind of help with the resources to assist people in creating a quit plan when they're ready to make that change, often because of policy changes.
Now, I know I'm kind of going back because there's been a lot of education surrounding tobacco, but bear with me here. We'll review for everyone. What are the components of tobacco that make it so terrible? Is it something that we do to it? Is tobacco by itself bad? How does that work?
Well, first I usually like to start by telling people in the most recent Surgeon General report, there's evidence that there's 7,000 burning chemicals in one lit cigarette. And some of that comes from natural combustion. Anytime you burn something and inhale it, you're going to have byproducts like carbon monoxide, tar, and other components. So that's essentially the most harmful part, is that exposure to those chemicals with every cigarette and other forms of tobacco as well. And then also the additives that the tobacco companies put in that essentially have been proven to be deadly, even in small amounts over many, many years. It can cause long-term health damage. So it's the components of during the curing and the pesticides from the beginning of when the tobacco plant is grown all the way to the additives that are put in the product by Big Tobacco. So that's essentially the most harmful part, is all the products and byproducts that someone's consuming with every dip or smoke that they take in.
Now, the nicotine, is that something that's already found in there, or is that an additive?
Nicotine is the natural insecticide in a tobacco plant. So in itself, it's very powerful, highly addictive. It's been proven to be as addictive as heroin and cocaine, and that's why for many tobacco users, it takes multiple quit attempts because it's highly addictive. It changes the brain, and so it's not the deadly part, but it's the addictive part. So all the byproducts and the chemicals that I mentioned are really what causes the health damage, but the addictive part is the nicotine that essentially affects and alters the brain and changes the brain, and it makes it very difficult for people to quit, and that's why it takes usually an average of 5 to 11 times for someone to quit.
So that was going to be my next question. What does it actually do to your body and mind?
Well, there's the behavioral part, which is the habitual routine. I have my coffee, I have a cigarette after my meal. So that's the behavioral part that we help on assisting people in creating change in their lifestyle. And that's a huge component, the psychological part. But then there's the addictive part, and that's where nicotine actually affects the brain, where someone that might be trying to quit or doesn't have their normal smoke break will experience withdrawal symptoms. And those withdrawal symptoms come from the brain needing that nicotine, and that can be irritability, anxiousness, anger, some of the same side effects you see someone withdrawing from heroin or cocaine. So it can be very uncomfortable, and that's why sometimes people aren't able to quit even if they're highly motivated physically. It's highly addictive, and that's why there are options that Tobacco Free Florida provides to make it more comfortable.
And obviously, you know, when you're breathing that in, that's definitely not good for your lungs.
Right.
And there's a lot of campaigns. I think Tobacco Free Florida has some pretty powerful ones, and they're, you know, it's not something you want to put into your body.
And Bethany had mentioned the change in your brain, the chemical change in the chemical component. One of the components within Tobacco Free Polk is we have what's called SWAT, Students Working Against Tobacco. And when you have that underdeveloped brain of a teenager, that makes that addiction even more difficult for them, and they get addicted quicker. So we have students that are educating their peers about the dangers of tobacco use.
So you mentioned ENDS earlier.
Yes.
Electronic nicotine delivery
Systems.
Thank you.
Yep.
Now, with the younger population, are those more popular?
We have seen statewide with middle school students since 2012, there's been a 300% increase, over 300% increase in students using ENDS, and in high school it's over 400% increase. So they're experimenting with it, and it can be addictive. There are chemicals in there, there is nicotine in there. The FDA just recently started regulating them beginning in August of 2016. So there is an age limit to that. It's 18 years old before someone can purchase it. There are going to be warning labels placed on them. Not only are the oils being regulated, but also the devices themselves. They cannot be promoted as a cessation tool to help someone quit using traditional tobacco unless they can prove, and that can take years to have evidence-based practices with that. So we really don't know what the long-term effects are going to be with ENDS just because they haven't been out for very long.
Sure, and back to your point, you're training your body at a younger age to have those behaviors or to smoke whatever, and you're linking that and associating that with maybe other things that make you feel good or whatever.
And oftentimes they're going from the electronic to the traditional tobacco. Right. And people that are using it as a cessation tool end up being dual users, using both of them.
The Tobacco Free Polk website, or the Department of Health website, if I am correct in quoting that, it says, if we are able to eliminate youth smoking, we can end the tobacco epidemic. Can you speak to that?
Well, yes, and we have done a great job with the prevention efforts through Students Working Against Tobacco, which actually was the Truth Campaign when it first came out, and now we've got the nationwide Truth Campaign, which is phenomenal, and they just came out with 2 very powerful commercials on how the tobacco industry is targeting the mental health population, as well as the veterans and those that are serving in our services. So that is going strong. The Students Working Against Tobacco, we have reduced the number of students that are experimenting with tobacco products. The biggest thing is prevention. Students who have started using tobacco before the age of 18 end up being adult smokers, statistically speaking. And it's very difficult, as Bethany was saying, it's very difficult to come off of that.
Let's say someone's addicted to tobacco and they want to quit. And you're going to refer them to Bethany.
Mm-hmm.
So what are some of the steps that they are going to take?
Well, the great thing about Tobacco Free Florida is there's multiple options, and we always encourage people to take advantage of all of them because they are completely free. And some of those are part of that campaign called Quit Your Way. So there is telephone coaching, web coaching, people can get emails, texts, and then there's also local support. As I mentioned, in Polk County, we have some great partnerships at local hospitals and different community organizations that host our sessions where they can come on site and get that in-person support. And as part of that, we also provide free nicotine products like patches and lozenges, which are approved and over the counter. And when you couple that with support, you're going to increase your chances of quitting. So we really encourage people that are thinking about or ready to make that change to engage in some of those Quit Your Way resources because there's no cost, and it shows that if someone that tries on their own, they're less likely to be able to follow through. Instead, when they have those support and resources, it's highly going to increase their chances of quitting.
This next question, it could be for either of you. Maybe you both have some comments. But if a friend or a family member is a smoker or a tobacco user, how do you initiate that conversation with them? You know, to get them closer to the idea of like wanting to quit. Like, what would your thoughts be on that?
I would encourage them as much as possible, but they have to be ready. We can say, you need to quit, we need to quit. They know that. They know that it's not healthy for them, but they've got to be ready mentally, physically, emotionally. This is something that they are holding strongly to. And just encouraging them, let them know there are free services out there when they're ready.
Mm-hmm. Yeah, absolutely. And the great thing about the Quit Your Way campaign too is that people don't have to be ready today. And so we encourage them to kind of think about and prepare and set a quit day and move towards that. So the great thing is even if people are not quite there, they can certainly benefit from some of our resources because it's unrealistic to think that most people can quit immediately right away. And so sometimes when they hear that and are reassured by our tobacco treatment specialists, they actually feel more empowered and more motivated. But sometimes people just don't know the resources exist, like Juli said. So we really encourage them just to reach out and try because it's better than doing it alone. But really there has to be motivation within themselves and just encouragement from loved ones and supporting them along the way, and understanding that there's a great chance that it may take multiple times.
And oftentimes it's a cost factor, not just the cost of the product itself, but they're paying about 34% more in healthcare costs than a non-tobacco user. So, what could you use with that money? What could you go purchase? What would you use that money on? So sometimes that is a motivator.
Oh, yeah. I see where you're going with this. So before we get into that, you would approach, say, a business instituted some policies that changed the way their campus operated. For their employees, it would be sort of a similar entry into some of these cessation programs.
Absolutely. The same services and the same sessions and coaching that we provide throughout the community for Polk County residents, we can come on site and provide in-person private sessions for the employer if they had enough employees interested. So it just removes some of those barriers with scheduling or transportation or different shift changes where it makes it a little bit more convenient to hold it right on site, oftentimes during lunchtime or after shifts or before shifts. And so it just kind of removes some of that, the challenges that people often have as to why they may not want to participate, or if they're thinking about it, if they're able to offer it right on site for their employees, it can be more convenient. And it's the same program, so it's free support, free coaching, free nicotine products, and it's all at no cost to the employer as well. So it's a great resource for them.
Well, that's a great point for us to transition into our next segment. Bethany, it's been wonderful having you with us. We'll be right back after the break with Juli Davis and Sarah Breed from Lakeland Chamber of Commerce. Stay tuned. You're watching Picture of Health on PGTV.
Everybody buckle up. Buckle up. Buckle up. Buckle up. Everybody buckle up. Buckle up. Buckle up. Everybody buckle up.
Let's go.
Buckle up.
Can we go to the store? Can we get some ice cream?
Buckle up. Everybody buckle up.
Everybody buckle up. Let's go. Everybody buckle up.
Everybody buckle up.
We here in the Sly Fox family want to spread the word that everybody should buckle up. Even if it's just a short trip, make sure that your tweens, your kids, you yourself are setting a good example and buckling up. So our daughter is 10, which is around the age that kids start complaining about buckling up. You know, they tell you it's a little too uncomfortable, or it's just a short trip, whatever their excuse is. At this age, it's like all of a sudden they don't want to buckle up. If you're a parent, you know this, that you do have to pick your battles. Sometimes you just let the kids just be and you don't mess with it, but with safety, that is not up for negotiation.
And nothing is more important than our kids' safety, so we never give up till they buckle up.
Welcome back to Picture of Health. In case you're just tuning in, I'm here in studio with Juli Davis, and now we're joined by Sarah Breed from the Lakeland Chamber of Commerce. We're discussing ways in which Polk County is helping people quit tobacco. Sarah, welcome.
Thank you.
So we were talking about worksite tobacco policies and tobacco-free work sites. And I understand yours is now one?
Well, yes, well, we've started to create an initiative with Juli. We started talking last year about what could we do to promote worksite wellness. You know, the Chamber is all about creating climates where business can prosper, and that trickles all the way down to worksite health. We want healthy employees, you know, a healthy workplace. And so Juli and I decided to, you know, what could we do? And we kind of ran into some bumps here and there about, you know, what we'd like to offer. And we decided instead of reinventing the wheel, we would present our chamber investors with the opportunity to fill out the already existing worksite wellness assessment from the Bureau of Tobacco Free Florida. And it kind of went from there. And so we decided to offer our employees this survey, which it's not very long, but you do have to do a little bit of research because it takes information about demographics, tobacco-free, smoke-free grounds, as well as health insurance information. And once we get that assessment information in, then some businesses are actually awarded gold or silver status based on how they scored. And any chamber investor that fills out the form, we give them a couple of free passes to one of our business after hours events. We you know, then we'll recognize them with window decals, mentions at our annual dinner if they achieve these gold or silver statuses, and, you know, anything we can do to promote and get people talking about it, because most people don't even know what policies they have. And so, you know, if we can spread awareness and get people to just start talking about it, then that's where change will start.
Absolutely. And if we back up just a second, I want to make sure that we're clear on some of the benefits of these smoke-free workplaces.
So benefits are huge. First of all, you're going to have healthy employees. You're going to have less sick days. You will also have greater productivity. On average, one tobacco user in an agency costs approximately $6,000 per year. That's medical costs as well as productivity. A tobacco user, as I had mentioned earlier, pays about 34% more in health insurance costs than the non-tobacco user. There is about 75% of productivity lost within smoke breaks, and the 3 15-minute smoke breaks is over a week of lost time per year. So the benefits are huge. There are so many components to worksite wellness, and tobacco is one that is, it's easy to incorporate. We are actually in Florida down to just over 15% adults using tobacco products. So that's huge. We've gone way down, but we still have that issue, and it's still costing employers money.
So you mentioned earlier that you work with businesses and workplaces to strengthen policies. Right. So how does that work? What does that look like?
So we have the Florida Clean Indoor Air Act, and that's what a lot of people base their policy on. What that doesn't include are the ENDS products, the electronic nicotine delivery systems, which you talked about earlier. And so it's catching some of them off guard when they have possibly a customer or an employee that is sitting there with their ENDS and it's not in their policy. We really don't have a leg to stand on. So we encourage them, it's just easy, just add it into your policy. We also want them to offer the cessation services through Tobacco Free Florida and the area health education centers. And if they have enough employees that are interested in learning more about quitting, we can set up a class right there on site, as Bethany had said earlier. So we encourage them with the policy. We encourage them to encourage their tobacco users that they have as employees to give them those tools, but sometimes they need a little more. So we encourage them to look at their insurance policy. What types of medications are included in their insurance policy? What kind of counseling sessions are included in their insurance policy? So making sure that there's this safety net for those folks to go to and to get the cessation services that they need.
If, say, somebody didn't want to necessarily go through their workplace to be linked to this, how would they determine if there was a class in the area?
They can go to tobaccofreeflorida.com, and there is a section called Group Quit that they can click on that, and there's a calendar. They can click on Polk County, and it will give you a calendar of where the classes are available in Polk County.
So it's cost effective to not have your employees, being unhealthy essentially and being non-productive. I think that's probably one of the bigger pieces that people don't look at. And I can tell you, I've had plenty of friends and colleagues that step outside and it's like, how long have you been at your desk? And it can really, I guess, like you said, that time can really add up. So now you mentioned an assessment. Tell me a little bit more about that.
Well, it actually comes through the Bureau of Tobacco Free Florida, and Bethany has graciously sent that out to the members of the Lakeland Chamber of Commerce. And it asks questions about, as she said, how many employees do you have? How many of them are tobacco users? What is your policy? Is it a written policy? Is it an unwritten policy? Do you have designated smoking areas? And excuse me, it also asks specifics about their insurance. If they offer the over-the-counter medications or the prescription medications, if they offer phone counseling, face-to-face counseling, web counseling, any of that type of counseling or coaching. And then what I do is I look at that and I see if there's any gaps that maybe we can strengthen their policy and or strengthen what they offer through their insurance policy. And through the Florida Cessation Alliance, Tobacco Cessation Alliance, there is a Worksite Wellness Award. And for businesses that offer at least 3 of the 5 medications and counseling over the phone and no cost sharing, they would be awarded a silver status. Gold status has all 5 of the approved medications and counseling sessions as well as no cost sharing. So we look at that. if businesses are interested in learning more about that, we can set up an appointment with one of our staff, and we can go in and, this is how you can do the tobacco policy, strengthening it. Sometimes they'll actually have us say, okay, where on our property would be a good place for a designated smoking area? Because we've got these receptacles right by the door, but people don't want to walk through our business smelling the smoke. So sometimes I'll go out with a tape measure and help them figure out 25 to 50 feet away is good. So that's pretty much what we do, and then we will encourage them. We also, if they have tobacco users that are wanting to quit, I will reach out to Bethany, and she'll reach out to them and get a class set up for them.
And what is that assessment that we were just talking about? What is that called?
It is called the Worksite Wellness Assessment.
Worksite Wellness Assessment. And just to recap, you've sent these to all of the chamber members.
Yes, all of our Lakeland Chamber members. We've actually had about 15 fill it out, which is pretty good. And Juli is even meeting with 4 or 5 of them because they want to strengthen it for next year so they can try and achieve that gold or silver status. So,
and I've been very impressed with the businesses that I've worked with. They either currently have or want to adopt a no hire policy. So if there's a tobacco user, that's one of the screening questions that they have. Some of the hospitals are going to smoke-free shifts. So a tobacco user cannot use tobacco during their shift working at the hospital or the medical facility.
Wow, there's just so many things that you don't really consider when you're thinking about, this guy smokes, no big deal. But if this guy has 5 friends that smoke, then it's kind of a big deal when there are only like 15 people in a division or in a section. So
yeah, so when you consider each one of those is costing an agency $6,000 on average annually.
And I find it painful just to put gas in my car. So I can't be paying $6,000 out if I were a business owner. What else do we need to know about Tobacco Free Polk, Tobacco Free Florida?
Well, Tobacco Free Polk, we have a monthly meeting that meets at 8:30 on the 4th Thursday of the month in Lakeland. You can certainly contact me. Okay, it's area code 863-578-2157, and you can call if you're interested, and we help to address some of the issues that we're having with tobacco use in Polk County, such as the youth use of e-cigarettes. We're addressing that. There's also students working against tobacco, and we have clubs in the Winter Haven High School, George Jenkins High School. We also have Daniel Jenkins Middle School has come on board. So those will be starting up very soon in those schools. And those students, again, educate their peers about the dangers of tobacco use. And they do a lot of community events. There's also a SWAT chapter where members of those clubs will come together once a month and they work on chapter activities. And we take them on advocacy trips up to Tallahassee to talk to their decision makers. And it's just a lot of fun, and it's a great leadership program for the students of Polk County.
Absolutely. Get that word out and put down the tobacco. Well, thank you so much for being here. I appreciate everything that you've had to offer to our viewers, and hope to see you back.
Great, thank you for having us.
Well, that's all the time we have for today. If you'd like to catch this episode again, we'll have replays on Tuesdays, Thursdays, and Saturdays at 2 and 8 p.m. Or you can find us on the Polk Government YouTube page. Thank you for joining me on this month's Picture of Health. I'll see you next time.